Republicans who are voting yes for the bill. Congressman Michael Burgess and Congressman John Faso. Congressman, thank you both for being here on somewhat of a very crazy busy day, of course. Congressman Burgess, why are you voting yes?
Well, look, getting rid of the Affordable Care Act, replacing Obamacare, something I've been waiting for now 7 years and a day. So I'm excited about the opportunity this afternoon. I think we've got a good product. I really thank President Trump for putting his shoulder behind this and getting this done. I'm optimistic we're going to be successful here in the next hour.
Congressman Faso, why are we at this point? Why isn't this thing going through smoothly?
Well, it's not easy, and a lot of members, I think, frankly, some of the members on our side are accustomed to being in the opposition, and they're not accustomed to being part of a governing majority. And the fact is, when you're part of a governing majority, the perfect shouldn't be the enemy of the good. We should try to advance the ball, improve the health care system, as Congressman Burgess said. And we've got some good reforms in here. We're keeping some of the things in the ACA, like existing conditions and kids on their parents' plan until they're 26, but we're taking fundamental steps to reform the Medicaid system, to control its growth in the future, and also to open up the insurance market so people have more choices in insurance.
Congressman Burgess, what do you say to the Freedom Caucus members? How do they go back to their constituents and say, look, I couldn't vote for this when a big part of the campaign was replace Obamacare?
Yeah, that's a tough one, and I can't answer that. You do need to talk to those members. But should this fail, I think you can identify the people who are the architects of Obamacare in perpetuity, and we will know who they are.
Congressman Faso, former Human Services Secretary Tommy Thompson, speaking to my colleague Neil Cavuto earlier, said, if this thing doesn't go through, quote, it's a huge embarrassment for the president, Speaker Ryan, and all Republicans. Would you agree?
Well, what I would say is that the pundits will prognosticate about what happens if it doesn't pass. Our job is to go back and try to figure out what we can do, hopefully on a bipartisan basis, to figure out how we can restructure and reform the health care system, because the ACA is not working today. Obamacare is leading to increased premiums, very high deductibles. A lot of small businesses are being dramatically adversely affected. Yes, some people have been helped. There's no doubt about that. So what we've got to do is find out how we can move forward but improve the health care system for all Americans.
And I would just add that it's not certainly not a failure on the part of the administration. The time I've been here, I have never seen an administration as engaged on an issue as President Trump has been, and I'm grateful for his for the enthusiasm that he has brought to this vote today. If it doesn't go our way, it's not on him; it's on us.
All right. Have either of you gentlemen heard when this vote is actually going to take place?
Well, we're expecting it'll be sometime after 4:30, and so I think that's the expectation.
Is there time for this thing to get, a new lease of life, or are you very worried about the outcome?
Look, I've been here through some tough votes in the past, and sometimes you actually enter a vote not being entirely certain how it's going to work out. I've seen some of those things win. I've seen some of those things with the opposite of a win. I feel good about today. I really do think that there has been so much effort in putting into getting us to a good place and getting to yes. I'm confident that members are they'll look deep in their souls and decide to do the right thing this afternoon.
Very, very quickly, Congressman Faso, you've had 7.5 years to get this figured out. Why are we at this point after having so much time to get it right?
Because it's so controversial, and because it affects the lives of tens of millions of Americans. Virtually every American is affected by this in one way or another. So it's controversial, it's not easy, it's expensive, it's difficult, and there are entrenched interests wanting to defend the status quo. I think the left basically wants a single-payer system for everything, and the architects of the ACA, I think, anticipated that it was going to fail in order to bring about a single-payer system. I don't agree with that. I think more government control is not the answer to controlling costs, but also delivering high-quality health care for more Americans.
All right, we'll have to leave it there, but thank you so much, Congressman Michael Burgess and John Faso. I know you're very busy. Thanks for taking time to talk to us.